Hello friends, I am Dr. Praveen Chandra and I am the Chairman of Interventional Cardiology at Medanta Heart Institute in Medanta, Gurugram, and it is very nice to share with you some new information. I hope this year is going to be as exciting as before, and today I am going to share with you a new advancement which is happening in the field of cardiology. And here, as I am working in Medanta Heart Institute, and we have developed this Institute of Advanced Coronary Interventions and Structural Heart Disease, where we have started a new procedure for the last few years, which I am going to share with you, and of course maybe more later on. And this procedure is basically done for those patients who have severe or critical aortic stenosis. Like we see patients who have very tight valves and they are not able to undergo a bypass surgery, or the risk of surgery is very high. And sometimes even if they do not want to undergo a open heart surgery, in these patients we do a procedure known as TAVR, or also commonly known as TAVI. So in this procedure, what we do is we do a percutaneous implantation, whereby we put a small needle with something like an angioplasty, and through that femoral artery puncture we do this procedure. The procedure is done under local anesthesia, no general anesthesia, and typically the patients are now able to discharge in 2 to 3 days time. The valve looks like a very simple self-expanding or a balloon expanding valve. Many types of valves are available now. Some are made in India, some are made in America, and these valves are of course expensive but very effective. And I can tell you, in the last now more than 8-9 years, we have following these patients up. They are very durable, the patients do well, and now with more experience and with more evidence of this valve being used worldwide, we are able to say that it is a very reliable technique to treat patients of severe aortic stenosis with aortic regurgitation, and also patients who have weak hearts who also have severe aortic stenosis. So TAVR is the new technique which is very helpful, very user friendly, very patient friendly, and can be advised to these group of patients who are generally more than above the age of 65 years and have this problem. It is also done for those patients where they have already undergone a valve surgery, where the tissue valve is now degenerating after a period of 10 years, 12 years. In these patients we do again this procedure. This procedure then is known as TAVIV, which is Transcatheter Valve implantation. And so the next valve which is done in a failing valve is done without surgery, and the patients can go home in 2 to 3 days time. So basically this is a very effective, very safe and very efficacious procedure for patients with aortic valve disease. Thank you.